Hey guys, it's your favorite pipeline nurse practitioner. Today I wanted to talk about blood work. I'm always recommending that you guys get your preventative screening, and if you're exposed to metals, you get metal panels. But I kind of wanted to review why and what you might be looking for when you get your blood work done. Most every trade, there are things that you're exposed to that can cause changes in your blood work. If you're working around solvents or metals or fumes or whatever, farming chemicals, and you experienced fatigue, easy bruising, your gums bleed easily, nose bleeds, pale skin, night sweats, lymph node swelling, weird rashes, frequent infections, shortness of breath, dizziness, or you're around exposures a lot and you're just like, it's old age, I just don't bounce back like I used to. It is worth getting your blood work checked. There's a couple things you should look for. So low red blood cells is anemia. Low white blood cells reflects a change to your immunity. Platelet changes, either they're low or they're high. Low platelets cause bleeding. High platelets are at increased risk for blood clots. The most notorious exposure in the trades for blood changes is benzene. It causes aplastic anemia. That is when the chemical changes your bone marrow so that it just no longer makes blood cells. It can cause low white blood cells, and it can cause leukemias, especially AML, which is acute myeloid leukemia, and that is a blood and bone marrow cancer that grows pretty quickly. Benzene is in all kinds of stuff, most notoriously gas products, but it can be in degreasers, stuff you work with as a mechanic, oil and gas refineries. It's everywhere. People who work with metals, I talk about lead a lot, but it actually affects the way your body can make blood cells, so it can cause anemia. Some of you are exposed to radiation, nuclear work, mining, aviation. That lowers your body's ability, your bone marrow, to make blood cells and increases your risk for blood cancers. Formaldehyde, that can be in resin, manufacturing, funeral industries, chemical places, that has been associated with leukemia as well. And then solvents, toluene, xylene, and mixes of stuff. It can also affect your bone marrow and decrease blood cell production. Pesticides in agriculture, landscaping, pest control, that has been associated with lymphomas and leukemia. Many of you are exposed to a little bit of all of this stuff. Getting your blood work, just a regular blood count annually, get it done once a year, so you can watch the trend of how your blood work is going. And if over time your blood cells keep dropping or trending down or looking weird, you can catch these things early. And of course, as always, the best way to manage it is to avoid the exposures as much as you can. Respirators, gloves, wash your hands before eating, ventilation. So I've said it once and I'll say it again. It is so important for you to take care of your health, and the best place to start is prevention, both avoiding the exposure and going to see a healthcare provider to catch things early. If you don't have a healthcare provider or you don't trust anybody, I offer consults, so give me a call. I hope you guys have a wonderful week. I'll talk to you later.